So welcome everyone to our advocate recap on Hill Day. Hill Day was October 25th and 26th for virtual registrants. And some of us, DPAC board and staff, also went in person to Hill Day on the same week to advocate on Capitol Hill. So our two speakers today are Will Jennette and Torin Saltos. Just to give a little introduction, our mission as DPAC is to ensure quality of and access to care, medications, and device for patients living with diabetes, and to educate, inspire, and empower patient advocates, as well as lawmakers. So on both ends, we train people in the diabetes community on how to advocate and a little bit how the political system works. And for legislators and representatives, we educate them about diabetes and what people with diabetes go through. And so here are our two featured speakers for today. Torin attended our virtual Hill Day meetings a couple of weeks ago. He's a very dedicated DPAC champion. He's also part of our Champion Corps, which is a smaller group of champions who have opted for a higher level of involvement with DPAC activities and programs. Torin is always resharing our posts and attending every single event. He's very attentive, and we're so grateful to have him as an advocate. And as a little aside, if you're interested in joining the Champion Corps group, feel free to drop me a message in the chat or DM us on social media or email us through our website. And Will is a DPAC board member and a seasoned advocate in the diabetes world. He joined DPAC board and staff in person for meetings in DC on Capitol Hill a couple weeks ago. So I really want to commend him for making the trip all the way from San Diego, the cross-country trip. So we're honored and privileged to have both of you with us today, and thank you for joining us on the call. We can go ahead and get started. Where are you two from? I know I kind of gave it away for Will, but where are you from, and who did you speak to in your Hill Day meetings this year?
Oh, hello. This is Torin. I'm from Orlando, Florida, so the Sunshine State. And I had the privilege to speak with Representative John Rutherford himself. That was the first meeting I had on Thursday. And after that, I was able to speak to Katrina Rafferty, who was the legislative aide for Representative Mike Waltz. And the last meeting I had that day was with Nicole Wright, who was the legislative aide for Senator Marco Rubio. On Friday, I had the pleasure to meet with Jared Hans, who is the legislative aide for Senator Rick Scott. And the last meeting I had that day was with Alex Whedon, who was the legislative assistant to Representative Maxwell Frost, who I was actually the constituent for, and that was a good one too.
I, like Amanda said, came in to do in-person meetings in DC from San Diego. And for the board and staff in person, we had a little bit of a wider spread of people that we would speak with. So it didn't necessarily mean that we were their constituent. So I met with a lot of staff and a couple of legislators from generally the Southeast of the United States. So we met with Representative Guthrie in person as a member meeting, which was excellent. We had a lot of time with the representative. And then also the staff for Senator Warnock from Georgia, Senator Kennedy from Louisiana, and then Representative Barr from Kentucky, and then a few folks from Florida. I'm so sorry, team, that I didn't keep this. I don't have my app signed in anymore, so my exact meetings escaped me. It was a big day. Lots of walking back and forth on the Hill, but yeah, really great meetings.
That you remembered.
Right, that was what I could bring up in my recall.
Yeah, the app signed this out, so everyone who was there in person doesn't remember the exact.
Yeah,
it's
I recorded somewhere. I promise. We're organized. It's just not on my phone anymore.
Yeah. Yeah, thank you. And it's really nice, Torin, that you were able to talk with your direct representative. I think they're always more receptive in that circumstance. What were both of your main talking points? I know DPAC had a few points that we gave to you guys regarding specific legislation, but it's also very much a flexible, tell your story kind of situation. So if you could share with us like kind of the TLDR of what you said with your representatives.
Well, so we had a few asks that were presented that we wanted to, there's about 4 of them, and we wanted to stick to that with every meeting. So we were able to kind of set like a tone of where we were going. So the first ask was access to affordable insulin, known as the Insulin Act. The second ask that we had was access to obesity care through the Treat Reduce Obesity Act. The third ask that we had was for the pharmacy benefit managers, or PBM reform. And the fourth ask was monitoring the prior authorization process and enhance patient care. So those are all pretty relatable because, as an advocate, I was able to share my story. I was diagnosed with type 2 diabetes about 5 years ago. So it's kind of new to me. But a lot of my experiences were kind of related to the things that, person with diabetes needs, like which is access to affordable insulin. Because when I first got diagnosed, I didn't have insurance, and the insulin for me for the month supply was about $350. I was able to get to a better spot now where I have a fairly low copay and I can obtain it pretty easily because I have insurance. But it's not the same all across the board. And that kind of also related to the PBM reform, because I'm sure if you've heard Stuart Perry talk about it, if you've been a member of any Zoom meetings, it is pretty confusing. And so we just want to know why the price is the price, and it should be, able for anyone to afford it. And then also the Treat and Reduce Obesity Act. In my case, just from poor lifestyle habits, I was a pre-diabetic and didn't realize it until it was too late. So, that kind of relates to that. But those were our asks, and the conversation kind of flowed the whole time that everybody gave us the floor. So it was pretty good.
Yeah, I would say pretty much the same. We would, in the in-person meetings with the staff, I also made sure, especially for the legislative aides and stuff, to do a quick diabetes 101 recap for them. I don't think that, they have so many issues for possibly all of healthcare and another issue, depending on the office that they're supposed to be in charge of. That I tried not to take for granted that they would understand exactly what we were talking about. And it also gave me a good way to segue from like, here's who I am, here's my personal experience, my personal story of what I deal with, and then move into, and here's why I need your help, because insulin pricing is crazy. And one story that we or one thing that we said in a lot of our meetings that seemed to resonate with people is that like everybody in this room could go to the same pharmacy to pick up insulin and we're all going to pay a different number. And it's crazy, it doesn't make any sense. And we're going to lose money. The manufacturer of the insulin is going to lose money, and the pharmacy is going to lose money, and we're all going to be giving it to the PBM. And so staff seemed really receptive to understanding like how these are interconnected issues. And specifically, they all knew about PBMs. I think they're having a good moment in the sun on the Hill right now. And so they were all very receptive to our kind of feedback on that, saying like, obviously this system is terrible. And you're not just hearing it from patients, but you're hearing it from pharmacies, especially independent pharmacies and family businesses. And yeah, I think that was kind of something that really, really resonated.
Yeah, that was a really succinct and clear, direct way to put that. I feel like I might take that from now on too. Yeah, I'm really glad that that seemed to resonate with everyone that you talked to. That's kind of what I was going to ask next. What seems to resonate most with legislators, both in terms of content, like whether it was more of you felt that they were more attentive when you were talking about your story, or versus when you were talking about the facts, the legislation, or also what seemed to resonate in terms of maybe your manner of messaging, what you felt like they responded most to. Yeah, so what did you feel like was the most effective?
Yeah, so as far as talking with everybody, the first person that I spoke with was Representative John Rutherford. And that was, I think, the longest meeting that I had. He seemed to be like, as far as all the members of Congress, it seems like he'd been in the game the longest and kind of knew how to be, I guess, a politician, so to speak. But he was very nice to us, and he was very understanding of all the topics, and he was, informed with everything. And it wasn't just one of those situations, because I had a chance to participate last year, and talking to some of the legislative aides. They were just kind of just like, okay, we'll take some notes. Oh yeah, I think they're working on this. Okay, I'll get this back to my boss. Is kind of the vibe that I've had previously. But he was familiar with the PBM, and he kept on using the term, yeah, this is something that we're working on. So even though that we're working on it specifically for, our medicine, this is a chronic disease, but there's other chronic diseases and other autoimmune diseases out there. So, I mean, what we do, I think, is going to have a ripple effect in other people's lives outside of the diabetes or outside of DPAC. Other than that, Rick Scott, his aide was Jared Hans. He seemed to be very, interested in everything. He seemed to take a lot of notes, and he actually, when we brought up the topic about prior authorization, he kind of elaborated on his experience himself. His own personal story was that he was trying to get his hands on some medication for himself, and he had to jump through a bunch of hoops to obtain his medicine, and that by the time he got the phone call saying that his medicine was ready for him, he said he essentially forgot because it had been a few weeks. I'm not sure what medication it was, but I know for us, if you waited a few weeks for your medicine, you'd be in a pretty rough spot. So it's good to know that they understand that. And the last meeting I had with Alex Whedon, which was for Representative Maxwell Frost, he took the most notes, and he was actually curious to know like the House and the bill numbers. And like as we were able to provide the bill numbers, like the pharmaceutical benefit manager, it's the HR 5378, and he's like, oh yeah, but we've already been talking about that, which again goes to show that yeah, I guess they are doing a lot of work on PBMs because it does affect a lot of people. But as far as that goes, I think it went really well, and I think they were really receptive. There was one or two meetings where the aide had their camera off, and you kind of you lose something. I think there's a lack of depth there. So I mean, I could assume that they were paying attention to us and taking notes, but it is different, even though it is virtual, and we're not actually, in DC, boots on the ground like all you guys did. A great job, by the way. The people that we did speak to, that we were able to get on camera with, it felt really good, and I think they did listen.
That's really great to hear. And it was really nice to hear that one of the legislative aides shared their own story with you too. Did you feel like they did that in response to you saying your story, or was it just after you brought up the topic?
It was just after we did the asks, and
Oh,
that group we were in, there was a couple other people in that group, and I think everybody actually shared. He kind of chimed in. So yeah, I think it
wow.
was just, yeah, I go through that too, guys.
Yeah, that's a nice bonding moment.
Yeah. And those bonding moments are how they're going to remember you. Like it has they have a
Yeah.
personal stake in it, which is awesome. And it's pretty hard to meet anybody who doesn't know at least somebody who has diabetes. Like everyone has a friend or a family member with type 1 or type 2 somewhere. For me, I think what seemed to resonate most with legislators was kind of personal stories, not necessarily my own, but like just real world examples and explanations of kind of why what is on the books now is not up to what it needs to be. I think in my group, we met with a lot of legislators who were on the more conservative side. And so some of them did have some concerns about like the financial implications of some of the bills we were talking about. And so one of the things that I think struck me that we were able to make progress on that front was kind of admitting and acknowledging that the CBO score, if people even know what that is not a reflection of kind of what the bill is going to be able to achieve in the long term. And I think we were able to make some progress in helping some of these legislators, like legislative staff, understand that like the huge number that you're seeing on this arbitrary score is not actually going to be reflective either of the current situation or of what could be attained. And And I think several of them really did understand that, which was, I think, progress, because a lot of times legislators and their staff will hide behind that CBO score as a means of not supporting something because, during the election, their opponent can say, like, they voted to expand the debt by this amount or whatever, right? But I think acknowledging, like having them acknowledge the long-term savings and the flaws in like how the CBO score is calculated and why it's not reflective of exactly what's going on, I think was really good.
Yeah, and that shows it's really important to know your audience. That's something that for us to have that feedback, that's important because maybe next year we'll incorporate those kinds of like rebuttal type arguments so we can prepare our advocates to say that too. Was there any like wow moment in any of your meetings where you felt like you surprised the legislator or the staff, or even your fellow attendees?
I think there was one particular wow moment that I had at one of the largest meetings, which was with Jared, which was Rick Scott's aide. We had an advocate pop in a little late, but I believe her name was Julie, and she actually works with a nonprofit organization for type 1 diabetes screening in South Florida, if I remember correctly. And she was a very passionate advocate, and she just kind of got to take the floor and kind of explain, the importance of screening for, people who are lower income. And that moment, you could kind of tell that everybody that is already living with diabetes understands, but Rick Scott's aide was just kind of like, wow, this person has a lot to say and is super passionate about it. And I felt like that one, because you want to be as like to the point as possible and not be too over the top. I think with your emotions, and not that she was like emotional, but she was passionate. And you could tell that she really likes her work, and I think that part sunk in the most with the representatives. That it took me back a little bit. I was like, wow, this person has a lot to say. But I understand how passionate you could be sometimes, and how this makes you feel, especially when you're talking to the people in power who could potentially, change the course for people in the future for the better.
For me, I feel like there were a couple of little moments. I don't know if I had any like major wows that are sticking out. I think one of the better moments we had was we were in towards the end of a meeting with Representative Guthrie's staff. And then the representative walked in and we sat there and chatted for like another half hour and really talked with him about, PBMs and mostly PBMs, about kind of like, here's, we can all agree that this is kind of dumb. And so how do we get around this? Because and I think that was a really good generative discussion because he was able to ask questions and he seemed genuinely curious about stuff. And he referenced some other folks' bills they were already working on that he was getting ready to kind of help support that were even further than our own ask, which was just to kind of shed a light. He was kind of like, I'm already talking with these people about this set of solutions and this is what I like about it. So I thought that was pretty cool too, that we got to like really help provide context in the moment while he was thinking about it. So I think that's kind of one of our wow moments.
Yeah, that's great. I feel like people tend to have a very cynical view of politicians, but they are interested in these topics. And it's nice to see that they walked in during the moment and talked with you for 30 minutes about it. I was going to ask, will you join some members of DPAC board and staff for in-person meetings on Capitol Hill? And you're already an experienced advocate, but tell us a little bit about what it was like to attend those in-person meetings and like your key takeaways from it.
Yeah, I think in-person meetings can, like the virtual ones, can kind of go both ways. I don't know that it's necessarily inherently better to be there in person. But what I did think the in-person provided us the ability to do was kind of focus our efforts on people who we wanted to thank for some of the work that they're already doing. So for example, when we met with the staff of Senator Warnock, he's one of the sponsors of the Insulin Act. And so getting to sit down with his staff and say like, hey, listen, like we see what you're doing and we're really grateful for that. And like this, we want to be able to help you in the future and like be a resource for you when you need us. And so I think getting to use those in-person opportunities to have some kind of cherry-picked strategic folks to just say like, hey, thanks, um, and I think that was really beneficial for us in that way.
Yeah, I think it is beneficial to have some level of face-to-face interaction just to build relationships and see a person in the flesh. Torin, you're a dedicated DPAC champion, as I've mentioned before, and you've attended many DPAC events. Did you feel prepared for this year's Hill Day? I know you said that you also attended last year. And what was your experience like in general?
I think it was great. I mean, compared to last year when I first started, I feel that was put together pretty well because it was just like a series of email correspondence and kind of like the schedule and here's the Zoom link and be ready to log on. Whereas this time around, there was actually a portal for us, and I think that was pretty neat because it had the criteria, it had the schedule, it had the like a little bio on everybody that was going to be attending as far as the congressional side. So you could kind of click that link if you were unfamiliar with who you were meeting with. There was a breakdown of who they were, where they worked. The schedule was perfect. There was even the notes had all the bills and all the asks, plenty of stuff to be able to pull from for your research. There was even just like the if you needed help talking, there was little talking points that you could elaborate on if you weren't sure what to say. So I think it was very neatly organized, and there was even a section for a follow up to send an email to the people that you met, which I think it was great. I think it was packaged well. I think it was a easy to use website, and I think it was super organized. I think everybody did a great job, whoever put that together. Thank you for letting me use that platform.
Yeah, thank you so much. Most of it was Jacob, who's not present, but he's here on the call. So thank you so much to Jacob. He also actually dropped in the chat, for anyone who doesn't know what a CBO score is. It's just a score to see how much a bill will cost the government. And as Jacob and Will are now saying, the math is it's just speculative. So that's the background of CBO score. Thank you so much for sharing that, Torin, and we're really grateful that it was helpful. We also had some like trainings events that we had that were a little bit more immersive, I think, than last year. So we were trying out some new things. So we're really glad to hear that.
Yeah, those trainings leading up to everything were fantastic as well.
Thank you. Well, thank you so much. And that again, that's mostly Jacob. So thank you, Jacob. Um, So just last question, although neither of you are new to advocacy, each experience speaking with legislators or congressional staff teaches us a bit more about the process, and what works and what doesn't. Is there something that you learned this time that you will take with you in your next experience speaking with a legislator?
Me personally, I would send more emails because after meeting with those individuals, I did send a follow-up email, and everybody that I emailed did reply back. So that kind of made me realize that you're not just kind of shouting into the void. You're actually doing work and having a correspondence with somebody. So for me, this just kind of opens my eyes more to realize that being organized and speaking up, people are listening, and this is going to have an effect. So just keep on doing it and just do even more.
Yeah, and DPAC has like lots of email templates that also you can just click a button and send to your legislator just in general when legislation comes out. So we help a lot with that. And yeah, there's like levels of interaction that you can have. If you don't have time or the energy or the space to go in person, you can always send an email, or you can make a phone call, or you can sign a petition. Yeah, and we really encourage any level of advocacy is still helpful.
For me, I think I have a couple of different takeaways. One of them is the leave behind packets were really good. Those are necessary. People like both the Congress people and their staff are pulled in a million different directions every day. So like you could sit with them for 15 minutes to talk about diabetes, and like in, 6 minutes later, they might be talking to like lobbyists from Boeing who need like, like it's just completely different change of gears. And they just get pulled in all these different directions. And so doing the hard part for them and saying like, let's take this couple of minutes for me to explain like why what I'm saying is important to you. And then like here are the exact like tasks, bill numbers, things, so that when they go and have, 90 seconds to write up notes and report about the meeting, those make it in. So I think that that's really important. And I think that we did it well, but I think we could even kind of like as a like the packet existed and was fantastic. As a person who was giving it to them, I think I could have emphasized it more and like maybe kind of, I don't know, referenced it a bit more intentionally. But I think generally like making sure you do as much of the lifting for them as you can to be like, here's like just low barrier to entry, because you want them focusing on you and not like trying to pull out their phone and figure out what bill number we're talking about right now, because that's a waste of really valuable time, especially with a member. But yeah, I would say that would be one of my big takeaways.
Okay, yeah, that's really helpful, and that's a lot of what we try to do is do the heavy lifting for the advocate. So yeah, we again thank you, Jacob, to put together all those packets. And for the in-person meetings, we had folders that we gave them in person that they could hold about and look at while we were talking. I know the same content was given on the virtual meetings. And so, yeah, I'm really grateful that we had that. I think that was really helpful for them to look at that and think back to their meetings that they had. So yeah, thank you guys. Thank you guys so much for joining us today. Jacob, if you want to pull up our slide with our social media, if anyone wants to scan and become a DPAC champion, or yes, this is what it is. Feel free to sign up. We're having our next brown bag on the 30th, and that one will be about a topic that we briefly touched on in our Hill Day meetings too, actually, which is type 1 diabetes screening. And that will be with, I believe she's the vice president of clinical implementation at JDRF. And she will be talking about type 1 diabetes screening, the stages of diabetes, why it's important to get screened. We recently also had an event in Times Square, and I think Usher was headlining it, which I didn't realize he has a child with type 1 diabetes. So we'll be talking about that on the 30th. That's a topic that I think is relatively new in the diabetes world, and not a lot of people know that screening, you can get screened for type 1 diabetes and potentially even delay the onset. So yeah, thank you so much. Please join us for that brown bag. And thank you, Torin and Will, for joining us today.
Thank you.
Have a good day, everyone.